Welcome to Ascension 21. Today, Laura Thiessen, a licensed clinical social worker with the Ascension Counseling Center, joins us for Post-Traumatic Stress Disorder Awareness Month. Now, this is a topic that takes place for awareness in June, but something that should be talked about year-round. It's very serious, and there's some things that we want to let people know about this month and in general. Thank you so much for joining us on the couch.
Oh, you're welcome.
So, Laura, tell me a little bit about the Ascension Counseling Center in general and what you guys do.
So we are a mental health clinic or behavioral health clinic, whichever you prefer, and we see clients to help them through various stages of life transitions, through various mental health issues, and we also have the narcotic diversion program, so we help those that are struggling with addictions.
The Ascension Counseling Center covers so much, but post-traumatic stress disorder is something that really should be discussed. Tell me more about what the Ascension Counseling Center is doing and what awareness should people know, residents, viewers, about this disease.
So PTSD, or post-traumatic stress disorder, is an anxiety disorder. And if you or an individual experiences a dangerous event, such as combat, a car accident, a sexual assault, anything of that nature that creates trauma in their life, we are there to help them through that trauma. It is normal to have upsetting memories after an event like that. What isn't normal is if those memories continue.
So at what point should a mother or a loved one or someone even for themselves start to think something maybe isn't right? Maybe I should go to a counseling center.
So when somebody is experiencing symptoms of PTSD, they will be experiencing things like, well, I explained that it's an anxiety disorder.
Mm-hmm.
Okay, so they will be experiencing things like flashbacks, nightmares, distressing images, or they will feel things like sweatiness or pain or feel like getting sick, things like that after an event. Constant negative thoughts about the event are also distressing to an individual. So an individual who has experienced one of these events may avoid the reminders of the event. They may try to push the memories away. They may isolate from individuals and just not do the things they're used to doing. They may feel some hyperarousal, things like being ultra sensitive to situations or being more aroused around situations, easily startled, irritability, sleep problems, or have difficulty concentrating. With kids, it's a little bit more, there are other things that you might want to see or that you might see, such as bedwetting or their inability to communicate with you, or them just trying to forget the event or play out the event again.
So how important is it for someone to seek help when they begin to feel these emotions?
So it's really important for somebody to get help, because if after, say, 3 months, you're still experiencing these symptoms, if that continues, then your anxiety is going to continue. You're going to continue to have problems in your personal life, in your professional life, and to work through those problems, there's a variety of things you can do to work through them. And if you work through them, then it won't become a problem for you for the rest of your life. Sometimes the symptoms don't all go away, depending on how intense it was, but it gets better over time. And that's what our goal is, to help you get better over time, even if those memories don't always go away.
So Ascension residents have the blessing of the Ascension Counseling Center, and a lot of people may not know that that is available to them. What if someone wanted to come and visit you guys, and if they have some of these symptoms or even dealing with some of the things we mentioned earlier, how can they get access to the counseling center?
So they can call the counseling center at 225-743-2445, and the intake person will talk to them about what's happening, and then they will be referred on for an appointment, and they can come in and talk to a clinician who will do an assessment and figure out exactly what they're experiencing and see what kind of traumas they've had, what kind of things. We look at the symptoms and then try to make a diagnosis and work from there on different types of therapy and things that might help them through it.
Well, Laura, mental health is so important for our community. Thank you so much for being in service to that. And thank you for sharing more awareness about PTSD with us today on the couch.
Thank you, Raven.
Thank you so much, of course. And if you want to know more or you feel like you want to call the Ascension Counseling Center for yourself or a loved one, that number is on your screen. Thanks for watching Ascension 21.